Okay, we're recording now, people.
Yeah. The professor is saying some of this preamble go on before it starts, and she's fine with that. So you can let me know when I'm lined up and I'm ready to go.
You are ready.
Okay, and I'll just start my thing here. Okay, so thanks everybody for agreeing to listen to me, and wanted to tell you about Rural Health Clinic. And one of the reasons why I chose this subject is because, you know, right now I am the manager at Shipshewana, but one day I might not be, and whoever is left on this team at that point is going to need to know something about how a rural health clinic functions. And so I wanted to kind of share the love of Rural Health Clinic and let all of you help you understand what's involved in the process. So what we're going to talk about today is basically the definition of a rural health clinic. I'll try to help you understand what that means, and then take you through the process of actually becoming a rural health clinic. Then at the end, just touch briefly on what's going to be ongoing as we go forward. So Rural Health Clinic is a federal designation. It is administered by state health departments. And when I think about Rural Health Clinic, I don't actually think about a clinic like Shipshewana Family Medicine. What Rural Health Clinic was really designed to do is to provide care in underserved rural areas. And so I like to think about more, imagine a tiny little clinic maybe out in the middle of Utah that's 100 miles away from a hospital. They can't even recruit a doctor to be there full time. They're using mid-level providers, and they probably have a doctor that flies in there every couple of weeks to provide some oversight. That really gives you a better picture of what rural health clinics were intended to do. They are for government payers only, so it affects your Medicare and Medicaid reimbursement. It does include your Medicare replacement plans. And there are certain requirements of rural health clinics that we're going to go through here as we go through the slides. So in becoming a rural health clinic, the first thing you need to do is to confirm that you're in a HPSA, health professional shortage area. And for us in Goshen Health System, Shipshewana Family Medicine happens to be the only facility we have, because LaGrange County is a HPSA, but that's the only area that we have right now. You also want to analyze your payer mix. That's to ensure that you have enough Medicare and Medicaid patients to make it worthwhile. Once you've decided then that you're going to go ahead with it, you file Form 855 to the State Health Department. We did that in late 2008 was my understanding. And then we finally received confirmation in 2009 that we were eligible to go ahead with the process. So then we went ahead and started to prepare for designation, and some of you will remember that awful failed survey that we had. I like to call that the false start survey. And so at that point we realized we really needed help, and we did a couple of these things backwards. We really should have hired a consultant right back at the beginning. But we hired our consultant after we had the failed survey. Mary did some phone calls. We were allowed to redo our survey. We brought on Beth Ann Perkins and Bill Collin, and they worked really hard with us to get us through the whole preparation for our survey. And so we began our preparation in earnest in about April of 2009. In preparing for the survey, what we really did a lot of was documentation gathering and preparation of policy and procedure. And this is something that would be important for another manager to know when they're coming into that clinic. What that has resulted in Shipshewana is that we have got basically 3 binders that constitute our Rural Health Bible. The first one is a policy and procedure manual that has different sections to it. We spent a lot of time developing and refining those policies and procedures. We also have Goshen Health Human Resources and HIPAA policies on file. And then we have a QAPI binder that's quality assurance and performance improvement, and I'm going to go over that a little bit more. In rural health, something that they stress over and over again, you can't just take hospital policies and procedures and just put them in a binder and say, okay, we're good. So we had to spend a lot of time making sure that these policies were specific to the clinic itself, specific to Shipshewana Family Medicine. We were able to make some exceptions with the HR and HIPAA because that's something that's governed by our organisation. So there's a little bit of give and take there. So then in preparing for the designation, there are other requirements that you need to keep in mind. You need to have all of your licenses and credentials available for the surveyor. You need to have health and education and training records. You need to have staff meetings with minutes. They really are big on that kind of stuff. They want to see that. need to do emergency response drills. You need to document when you did it and what the result was. They're also very, very big on logs for drug storage and housekeeping processes, so all of the cleaning things that you have to do on a daily, weekly, monthly basis, they want to see all of the logs. They want to make sure that that's all being taken care of. QAPI, Quality Assurance and Process Improvement. This is another really big deal in rural health, and this was one of the major reasons why we failed this the first time, is that we were able to say to them, oh yeah, we do quality assurance, but we couldn't show them anything that really spoke to that. So with Beth Ann's help, I developed a separate binder that is just for this. And we, as a rural health clinic, you have to have at least one meeting annually that involves not only the shareholders in the clinic, so your doctors, your administrators, but also at least one member of the community. And the person that we invited is the owner of the flea market out in Shipshewana. He's obviously a prominent community member, and he's a big employer out there. So he was able to help us kind of put our finger on the pulse of what goes on in Shipshewana and make sure that we're meeting those community needs. The other thing that we did that really helped us with that was a top 10 diagnosis review, and Sarah with our EMR helped me get that done. And that really helped us to look at what are the top 10 diagnoses that we're making here in this clinic, and then are we doing things to really focus on those patients. And what that then has resulted in, although we didn't really have a name for it then, but we do now, is this whole medical home concept. And so we're working on that out in that clinic this year, and it really is centred at the moment around our diabetes patients and creating a diabetic program. So when you are surveyed, whether it's initially or ongoing surveys, they're really expecting to see stuff like this, and if you don't have something that's very clear on file that shows it, you're not going to pass. So we did lots of mock surveys and drills. That was a lot of fun. Lots of policy and procedure review. We had meetings just for reviewing policy and procedure. We then sent our notification of preparedness to the Indiana State Health Department. And then finally, on the 4th of November, we had our surprise survey. We went and did it, and it went very, very smoothly with a lot of help from everybody. And finally achieved the designation. We had a clean survey, so that was very, very exciting.